The situation is very concerning. We're deeply concerned, actually, because not just the cases, number of cases, but the number of deaths is also increasing. So to have a dent on the transmission to make a significant impact, there should be very serious social measures that should be taken, and with the participation of the community. I think was yesterday's data I was looking at had already crossed 2,000 deaths per day. So it's getting very serious, and I think starting from the government, all stakeholders should really take it seriously. I said it last time, Brazil neighbors many countries in Latin America, almost all of them except a couple. And some countries are doing better in the neighborhood. But if the situation in Brazil continues to be serious like this, then the neighboring countries will be affected. And it's not about the neighboring countries, but it could go even beyond.
Or do you support some of the pause that's going on? And also, can you sort of clarify the difference between...
And there should be clear message from the authorities on what the situation is and what measures should take, and enforce those measures with full participation of the health system and the population. Unless a serious measure is taken, the upward trend, which is now flooding the health system and which is becoming beyond its capacity, will result in more deaths.
Would like to see Brazil going in a different direction, but it's going to take a huge effort for that to happen. The system is considerably pressurized right now, and while many countries in Central and South America are moving in a good direction, Brazil is not. I think the DG said it, that this needs to be taken very seriously in Brazil. Certainly the situation in Brazil has worsened. There's a very high incidence of cases and increasing death incidents across the country. Certainly a very rapid increase in ICU bed occupancy, with many areas around the country running out of ICU beds, and interestingly, Amazonas actually improving situation with ICU beds as the wave passes through and the health system recovers. Other parts of the system and other parts of the country are coming under extreme threat. The Midwest and South regions have ICU bed occupancy more than 96%. So 96 out of 100 ICU beds are occupied. There's very little resilience and capacity left in the system. This is unlikely right now, based on the genetic sequencing, to be linked to a fresh zoonotic reservoir, and much more likely to be linked to persistence or latency of infection in a human subject, and that would be probably the longest period of time that such an event between such two events. Now, that I'm cautioning here, these are the first results, and there's more studies that are needed.